Hi, I'm Dr. Bryan Kansas with Urology Austin. Today I'm going to talk about low intensity shockwave therapy and its many applications in urology. Low intensity shockwave therapy, or LIST for short, is a therapy that's been successfully used outside of the United States for over a decade. More recently, it's been popularized in the United States as a treatment option in multiple fields, including urology, orthopedics, and wound care. The basis of this treatment is to deliver ultrasonic shock waves to damaged, degraded, or poorly healing tissues. Essentially, LIST calls upon the body's natural healing mechanisms to achieve several responses. It creates better blood flow in the area being treated. It calls up healing cytokines and stem cells in the body to repair, over time, the damaged, degrading, or poorly healing targeted tissue. In urology, there are multiple applications for using shockwave therapy. We use it a lot for erectile dysfunction and PEYRONIE'S disease, male and female pelvic pain, mild female stress incontinence, and also mild enlarged prostate symptoms such as urgency and frequency. As far as using this for erectile dysfunction, what I like to do in my patient consult is first go over all the different treatment options for erectile dysfunction. I go over the precise mechanism of erectile function, including the fact that an erection is simply more blood flow in, arteries, then out, veins equals erection. My next step is to evaluate them to see how much of their erectile dysfunction is an arterial or a venous issue. Again, shockwave therapy is used to help heal the arteries, dilate them, and create better inflow. However, if the patient has significant venous outflow issues, that's not repairable with shockwave therapy or really even a surgical procedure. So what I typically recommend to most ED patients is a penile Doppler ultrasound. This is a non-invasive study done in our office. It's a very simple procedure, takes about 20 or 30 minutes to perform. This allows us to get objective data on what the patient's arterial inflow versus their venous outflow looks like. Therefore, I can help the patient make the best decision for their treatment plan moving forward. As far as using shockwave treatments for PEYRONIE'S disease, the truth is anyone really is a candidate, no matter their curve. The basis for this, again, is creating blood flow and softening the scar tissue. We also have the patient manually manipulate and flex the penis opposite the curve in order to stretch out the scar tissue. This has really been very effective. I've typically seen 50 to 60% improvement rates in curve post-treatment. In addition, I tell my patients with PEYRONIE'S disease, who often will have some mild erectile dysfunction, that they're essentially going to get a 2-for-1 out of shock waves, because they will also see an improvement in their vascularity and their arterial flow, thus better erectile function. As far as the use of shock waves in pelvic pain, the basis of most pelvic pain is muscular dysfunction and tightening in the pelvis. What happens during shockwave therapy is that we see muscular relaxation. We also see improved blood flow to those tissues and therefore relief of the pelvic pain. Pelvic pain treatments are typically a little shorter as far as the number of treatments. In general, the number of shockwave treatments depends on what we're treating. Typically, though, we schedule the patient for 3 to 6 treatments. As far as maintenance goes, I usually don't recommend maintenance treatments for erectile dysfunction. Once we have success for erectile dysfunction, we see success for treatment typically for 2 to 3 years. After treatment success, what I recommend is that the patient just tell me after the 2 to 3 years that it's time to repeat the treatment. This is a much more cost-effective approach for the patient. The same goes for pelvic floor pain and pelvic floor dysfunction. Best thing for these patients to do is just to allow them to tell us when their pelvic floor pain recurs. Oftentimes we see 12, 18, 24 months of relief from their pelvic floor discomfort after shockwave therapy. So this is the Urigold Softwave machine. To date, this is the latest, greatest shockwave system available. It's great because we can treat so many different types of disorders. We're able to get better depth of penetration for better results in all of these disorders. This is the application tip here. This is what actually comes in contact with the skin with a sleeve type of mechanism over it. Normally, the treatments themselves are not uncomfortable, so we don't need to use a local anesthetic or a topical anesthetic at all. That's what it sounds like. really does not hurt at all. So with the Urigold Softwave machine, it's really not painful. Patients don't require anesthesia, analgesia, sedative, nitrous oxide, pain relief, or reduction for really any reason. As seen in the video, I can put my hand on it, it's not painful at all. As far as side effects, typically these are minimal, but can be local. Patients can have some redness of the skin or slight discomfort, easily treated with Tylenol or ibuprofen. Patients might have a little bit of bruising because of popping of small blood vessels near the skin, but nothing major or significant. As far as costs, private insurance and Medicare do not cover this procedure. It's an out-of-pocket cash expense for the patient. Finally, low-intensity shockwave therapy has many applications in urology. Urology Austin is a well-versed low-intensity shockwave therapy provider. All of our providers see patients who can be treated with this system. If you have questions, please ask your provider for more information. I'd also be happy to see you for a consultation. Thanks for watching our video on low-intensity shockwave therapy. I'm Bryan Kansas with Urology Austin.